Welcome to Unit 8, Concept of Teaching and Learning. In this unit, we will explore the fundamental principles, strategies, and methods of effective teaching and learning, especially in the context of nursing education. This lecture is conducted by our respected faculty, Mrs. Noorjehan Afzal, BScN RM, who brings her vast knowledge and expertise to guide us through this journey. By the end of this unit, you will gain a clear understanding of teaching approaches, learning styles, and practical applications essential for improving patient education and clinical practice. Welcome back to AL-Biruni official YouTube channel. In today's video, we'll discuss a very important health topic: Introduction, Concept of Teaching and Learning. In this unit, we'll explore the meaning, process, and importance of teaching and learning, focusing on effective teaching strategies, different learning styles, patient education, and developing teaching learning plans in clinical practice. The purpose of this session is to help you understand how teaching can positively influence learning outcomes and improve patient care. Do not skip any segment of this video, as every part contains valuable information. Also, you'll find the proposed BCQs from this lecture in the description section below. Make sure to check them out for your learning and exam preparation. So, let's begin. Understanding teaching. Teaching is not just about delivering information. It is a planned, deliberate, and goal-directed process. It involves designing and implementing instructional activities that help learners achieve desired outcomes. Teaching also means attending to people's needs, experiences, and feelings while making meaningful interventions to help them learn. In other words, it is an active process where the teacher shares information to bring about positive changes in behavior, knowledge, and skills. Teaching as a process. The concept of teaching can be understood from two perspectives. In the bipolar process, teaching focuses on the direct interaction between the teacher and the student. However, in the tripolar process, teaching also involves the curriculum and society, where the teacher, student, and environment work together to create meaningful learning experiences. Types and methods of teaching. Teaching can take two main forms: formal and informal. Formal teaching is structured, planned, and takes place at a specific time and place with clearly defined objectives, such as classroom lectures or skill demonstrations. Informal teaching, on the other hand, occurs spontaneously whenever a learning need arises, such as answering a patient's question or explaining a nursing procedure during care. To achieve effective teaching, various methods can be used, including explaining concepts, demonstrating techniques, collaborating with learners, and even encouraging students to learn by teaching others. Understanding learning. Learning is defined as a change in behavior, knowledge, skills, or attitudes that occurs as a result of experience and exposure to different situations. Learning is continuous and can happen at any time or place. However, different people learn in different ways, which is why understanding learning styles is crucial. Learning styles. There are three major learning styles. Visual learners process information better when they see images, diagrams, charts, and videos. Auditory learners learn best by listening to spoken information, discussions, and lectures. Kinesthetic learners, also known as tactile learners, prefer hands-on experiences, role-playing, and actively engaging in practical tasks. Recognizing these differences allows us to customize teaching methods to make learning more effective. Barriers to learning and how to overcome them. Learning is not always straightforward. Several barriers can affect the process. These include environmental distractions, socio-cultural differences such as language or educational background, psychological challenges like stress or anxiety, physiological limitations such as hearing or vision impairments. To overcome these barriers, we must facilitate learning by motivating learners, encouraging active participation, providing timely feedback, maintaining a suitable learning environment, and introducing information gradually from simple to complex concepts. Keys to effective learning. Regardless of your preferred learning style, there are some important strategies to improve your learning experience. Actively participate in discussions, connect classroom knowledge with real-life situations, ask questions, share ideas, and stay focused during lectures. Keep an open mind and remember that learning never stops. Every experience inside and outside the classroom contributes to personal and professional growth. Importance of health education. In the context of healthcare, health education plays a vital role. It provides individuals with essential knowledge and practices to adopt healthier lifestyles and prevent diseases. The main aims of health education are to promote health, prevent illnesses, ensure early diagnosis and effective management, and encourage the proper use of available health services. Through health education, patients become more aware of the factors affecting their well-being and are empowered to make informed decisions about their health. Objectives of health education. To make health education effective, we must set specific objectives, which include increasing community awareness about the value of health, promoting healthy behaviors and lifestyle changes, encouraging preventive practices, informing the public about medical advancements, helping people make better use of healthcare services, teaching strategies in health education. Various teaching strategies can be adopted to make learning more effective, such as lectures for structured knowledge, drills and practice for skill building, demonstrations for practical learning, compare and contrast techniques to clarify differences, guided and shared activities including reading, listening, viewing, and thinking together. Teaching strategies in health education. Various teaching strategies can be adopted to make learning more effective, such as lectures for structured knowledge, drills and practice for skill building, demonstrations for practical learning, compare and contrast techniques to clarify differences, guided and shared activities including reading, listening, viewing, and thinking together. Teaching learning plan. One essential tool in nursing education is the teaching learning plan. This is a written guide for instructors to achieve specific learning outcomes. It outlines the objectives, required teaching materials, equipment, and the overall training process. Developing such a plan ensures that teaching remains organized, systematic, and focused on desired results. Understanding patients' learning needs. In clinical practice, understanding the learning needs of patients is extremely important. Every patient has unique needs based on their age, education, literacy level, and language. We must use simple and clear language, avoiding unnecessary medical jargon. For example, instead of saying myocardial infarction, we should say heart attack unless we explain the term. It is equally important to involve family members, as they play a key role in ensuring continuity of care after hospital discharge. Key areas of patient education. Patient education should cover a wide range of topics, including proper medication use, nutrition, medical equipment handling, rehabilitation techniques, personal hygiene, pain management, psychosocial support, patient rights and responsibilities, and follow-up care. By tailoring information to each patient's understanding, we help them take control of their health and recovery. Purpose of patient teaching. The main purpose of patient teaching is threefold. 1. To maintain and promote health. 2. To prevent illness and restore well-being. 3. To help patients effectively manage their conditions. When patients and their families are educated properly, the quality of care improves significantly. Educated patients are more likely to follow treatment plans, avoid complications, and recover faster. Client education and its benefits. Client education benefits both patients and healthcare providers. It reduces hospital stays, lowers the chances of readmission, improves patient satisfaction, and increases compliance with treatment regimens. Moreover, health education helps patients adopt healthier lifestyles, ensures continuity of care, and supports greater independence in performing daily activities. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to AL-Biruni official YouTube channel for more informative health and medical education videos. And if you have any questions or queries related to today's topic, feel free to write them in the comment section below. I'll personally try my best to answer each one of them. Remember, knowledge shared is knowledge multiplied. Stay curious, stay updated, and keep learning.